Hi, I'm Dr. Daria Klachko Totten.
And I'm Dr. Michael Nusbaum, and welcome to
HealthTalks.
So I understand you want to talk about nutrition during pregnancy.
Yes, I do. And I want to say that I'm an OBGYN.
You are.
I'm commonly talking about menopause here.
And board certified OBGYN.
Board certified OBGYN, and I have extensive experience of taking care of pregnant women. So I think a very important topic to talk about is what can we eat when we're pregnant?
Absolutely. I'm sure you got that question a lot when you were delivering babies.
A million times. And I think it's super important to realize that when you're pregnant, what you're eating can directly affect the pregnancy.
So what are the things you have to be careful of and avoid when you're pregnant?
I would say be careful of eating anything undercooked as far as poultry and meat. Everything should be well cooked. And what we worry about here is food-borne bacteria, Listeria, E. coli, Salmonella. These things can, sometimes pop up in different types of foods, and you have to be really careful about what you're eating. So meat well cooked, chicken well cooked. Be careful with things like deli meats,
right.
Hot dogs, certain types of sausages. And generally the rule is don't eat those things. If you want to eat, let's say you're craving a turkey sandwich. Well, if you want to eat the deli meat, cook it till it's steaming. So everything should be cooked.
That's a good idea. So have a hot sandwich.
Have a hot sandwich instead.
Exactly. So the rationale here is that those bacteria produce toxins, right? And I assume the toxins
Absolutely.
can somehow cross that placental barrier?
Yes. Well, some toxins can affect the pregnancy.
Okay.
Other toxins can just get you sick.
Gotcha.
And you don't really want to get sick if you don't have to get sick.
Gotcha.
Right? So also avoiding things like pre-made salads, pre-made egg salad, or coleslaw. These can harbor certain types of bacteria as well. So make that at home if you want to make it. So you know what you're putting in, you know how long it's been standing out, and be careful. Refrigerate things that can spoil easily, quickly. A big question that we always get asked is about seafood.
Okay.
Can we consume seafood? And generally, yes, and you want to do in moderation, of course, but there's certain types of fish that you have to be careful with.
Okay.
And those are the big fish that eat other fish, like shark, mackerel, swordfish, also certain types of tuna, like ahi tuna. Generally they say the light tuna in a can is okay. But the bigger tuna to avoid and stay away from.
I'm assuming this is because of mercury levels?
Yes, absolutely. It's because of higher mercury levels in those fish that are the big fish that eat other fish.
Right.
So definitely watch out with that. And I also get asked a lot about cheese. I'm a cheese lover. I don't know if you like cheese.
I do.
I love cheese. So, but be careful when you're pregnant with the soft cheeses, like brie, camembert, and the blue vein types of cheese. Stick with more like Swiss cheese or cheddar cheese.
So harder cheeses. Is that because of bacteria?
Yes, it is.
Okay.
Mm-hmm. Absolutely.
Yeah. So those cheeses actually have bacteria in them, and
yes.
Those can be harmful.
And always watch out that things are pasteurized when you're pregnant as well. So pasteurized cheese, pasteurized milk.
Gotcha. What about caffeine and beverages?
And caffeine.
Alcohol.
So important to some of us. I know it's so important to me. Do you drink coffee?
I don't.
Squeaky clean, this guy, I tell you.
But I know a lot of patients are like, I'm going to Starbucks, but I'm pregnant now. Can they still go? Or
Yes, absolutely.
What's the rule with caffeine?
So you should try to aim for less than 200 milligrams per day, which is about the size of like a 12-ounce cup of coffee. So you can have caffeine, but just limit it to a daily amount. And remember, chocolate has caffeine, hot chocolate has caffeine. There's other, you look for what you're eating and drinking, so that's less than 200 milligrams per day.
Interesting.
And a good place to look, if you're ever wondering about food, a really good guide is the CDC. So if you look on the CDC website, they kind of give you a list of preferred and things to avoid. I think it's a great way to, quickly check if you're thinking about it, and also important to discuss with your doctor.
So we actually have a pregnancy nutrition program here with our registered dietitians. What would you recommend? Something for patients to do that routinely? I mean, a lot of our patients had requested it. That's why we have a nutrition during pregnancy program. So you're under the supervision of a registered dietitian.
I think it's fabulous. I think it's a fabulous idea. If you are, a healthy eater, you feel like you've got this under control, of course, you can do this on your own. But if you feel like you want to be careful through your pregnancy as far as weight gain, it's such a great idea to talk to a registered dietitian, get on a program, so that you can learn to eat correctly and that you can learn to eat in a way that's nutritious for your pregnancy, but it's also, you'll gain the weight that you need to gain and not gain excessive weight.
Absolutely.
And then you learn how to eat after pregnancy as well. Like, you start to understand what foods have high value as far as your nutrition and what has low value. So I think it's an excellent type of program to join.
Terrific. Well, I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thank you for joining us at Health Talks.
Bye.
Bye.